challenges and other challenges in reporting the COVID-19 pandemic. I'm Wayne Sharp, health media specialist with the Internews Rooted in Trust project, and Internews is one member of the group hosting this dialogue, the media task force of the Eastern and Southern Africa Interagency Working Group for Risk Communication and Community Engagement. In previous media dialogues, our health media specialists have provided tips to journalists on how to cover COVID-19. Of course, it's a challenging story to tell because of the science involved, and it gets even more complicated with each new variant that emerges. In this dialogue, we'd like to do something a bit different by giving the microphone to a senior journalist from the ESAR region who will tell us how he decides which COVID stories to tell and how to tell them. And of course, we are all now concerned around the world with this new variant, Omicron, which was first identified in South Africa and is now spreading incredibly fast around the world. We will hear today from a WHO epidemiologist to find out what the scientific community knows about Omicron at this point and what we as journalists need to know when producing stories about this new variant. But before we turn to our keynote speakers, I will first hand over to my co-moderator, Tole Nyata. Tole is an Internews pandemic media mentor based in Nairobi, and he's going to update us on some community feedback that the RCCE group has collected recently regarding COVID-19. Tole, can I pass it over to you?
Yes, please. Thank you very much. Hello, everybody, and thank you for joining us. Christophe, if you could share the slides, please. So before we begin the conversation, this dialogue, I'd like us to share some of the conversations that are going on in the region, in the ESAR region. And these conversations were collected between the 26th and the 2nd, and they are collected from different sources, both online and offline. Online, they come from search trends, social media content, and digital news. And offline, we have our community feedback channels, which include hotlines, community meetings, and radio programs. Next slide, please. So some of the issues that were picked with regards to COVID-19 are on travel restrictions. There were questions and concerns raised on the decision, on Europe's decision to close the Southern African countries when there were other regions which had higher COVID-19 infection rates. And there were also claims that there were countries which have identified or detected the different variants, but they are not reporting. These were concerns which were seen in South Africa, Zambia, and Zimbabwe. With regards to the government measures in response to Omicron, folks are concerned about the public health measures, which might include lockdowns, which may be implemented because of the new variant. And the statements included concerns on the livelihoods of the people. They are afraid that there might be closures to businesses, schools, there might be lockdowns and other restrictions. These were seen in South Africa and Zimbabwe. With regards to symptoms, there were questions about the symptoms of this new variant, both online and offline. Folks were asking how deadly it was, how quickly somebody can recover from the variant. And something interesting is that the Omicron variant symptoms was a breakout search in Google in Kenya, Malawi, South Africa, Tanzania, Uganda, Zambia, and Zimbabwe. And also we had some online users, and including medical professionals, saying that the symptoms of this new variant are mild. Next slide, please, Christophe. With regards to the origin, folks had questions about the naming of the variant and how different it is from the variants that have been already identified. And there were also claims that there actually isn't any new variant. It's a push for people so that there are new vaccine mandates and restrictions. There were also claims that it's a way to manipulate people further and continue with the depopulation agenda. We also had claims that the World Economic Forum published about the Omicron in July. This was fact-checked by AP. It was found to be false. There were also other claims that which were tracked initially in Zimbabwe, that Omicron was planned, and there was a movie in 1963 called the Omicron variant. Yes, there was a movie, but it was called Omicron. And this conversation was also found offline in Zambia. And it was fact-checked, found the claims were not true. Also, they were photoshopped movie posters, which were tracked in India and US on the same. So these were issues which were seen in South Africa, Zambia, and Zimbabwe. With regards to the effectiveness of the vaccine, there are concerns whether the vaccines are effective against the new variant, both online and offline, because people are saying that the Omicron variant is being spread by people who are fully vaccinated, and that the variant is only present in folks who are vaccinated. And also we had people complaining that the government oversold the vaccine. They sold it to them as a magic bullet that will solve the pandemic, but so far that has not been the case. Also, there were issues with regards to the effectiveness. Folks now are saying, I don't need to get vaccinated because the vaccine will not protect me from the new variant. Why should I go for the vaccine and it won't protect me? So these were issues which were seen in Botswana, Malawi, South Africa, Zambia, and Zimbabwe. And finally, with regards to vaccine safety, news that the Omicron variant was identified in individuals who were fully vaccinated. There was speculation that it's the vaccine that causes the variant. So these were the issues of concerns and the questions which were raised in our region between 26th and 2nd of December. We will share the latest feedback in your email list at the end of this conversation. Thank you very much, Wayne. Back to you.
Thanks very much, Tole. Just an indication of how quickly the rumors start forming and flying with each new variant that comes into the scene. Okay, now we'll move on to our first keynote speaker. John Muchangi is a journalist and science editor at The Star in Nairobi. He covers science with a focus on health, conservation, innovation, and development issues affecting East Africa. John is past winner of the CNN Africa Journalist of the Year Award in the HIV/AIDS category, and he is a fellow of the Knight Science Journalism Fellowship of the Massachusetts Institute of Technology, the world-renowned MIT. John has worked on coverage of the COVID-19 outbreak since March of 2020, and it certainly appears that he'll be covering in March of 2022 as well. The way things are working out, unbelievable. But here we are. Before John starts, I just want to remind everybody on this call, if you have any questions for John during his talk, please type them in the chat box, and Tole will get those questions and read them to John after his talk. So don't worry, your questions will get to our keynote speaker. So with that, without any further ado, welcome John Muchangi, and over to you.
Thank you very much, Wayne. Christoph, you can share the presentation. Maybe as Christoph shares the presentation, maybe I would like to ask you, do you remember the first day when you had your first case in your country. In Kenya, it was, I remember very well, it was March 13th last year. Actually, it's a very memorable day. I remember I was going to work in the morning when the Minister for Health announced that we had our first case. And that was on March 13th. Is almost 2 years now since the first case was reported. I think that was the first time I wrote about the first case in Kenya. And when I calculated the number of stories I have written since that time on COVID-19, it's been more than 200 stories. So I hope in the next 7 to 10 minutes, I'll share my experience with you and how I've been writing stories on about my coverage. And I hope you can pick out some useful things from my coverage. Christoph, if we go to the next slide. So it's actually when we wrote about the first case in Kenya on March 13, and then we had the closure of schools and a lockdown, a mini lockdown. Everybody was asking when is this going to be over? Actually, if you wanted to meet somebody, we would say famously, we would always say, yeah, we shall meet after the COVID is over. But actually, we've realized it's been a marathon with no end. This is 2022. We are still writing about the first Omicron case that was reported in Kenya today. So 2022 seems it's going to be a busy year now. So it's I hope we can I think from my experience, I realize this is it's not going to end soon. We can go to the next slide. So from my experience, when we started last year, first it was actually a disease that was mostly read about about China, about Europe. I think Africa started to be affected much late, and so for us it was something that we mostly picked from the international media. We didn't have any local cases, but when we had the first local case, what I realized is actually I had to learn the basics, the names, quarantines, epidemic, the difference between pandemic and epidemics, death rate, variants. Actually, at the beginning, we didn't have this term variant. It came much later, but we also had to learn about how the variants are named, how the different variants of concern, variants of interest. So really for any journalist, I think this is the basic, I think, which everybody here, probably other journalists here know, that actually these are the basics that we need to know. For many African countries, I think we were largely spared by the 2009 H1N1 epidemic. This is the swine flu. So for many journalists, we didn't have much exposure in reporting pandemics. I think for many countries, they were also spared the avian influenza. This is the bird flu and the MERS-CoV, I think. And a few countries also in West Africa and Congo, we reported about Ebola. So probably you may have some experience reporting about these outbreaks. Let's go to the second slide. So after understanding the basics, what I realized in my experience is that also I had to build partnerships with a new kind of scientists. And this is especially epidemiologists. These are scientists who study diseases within a population, and they analyze the causes of disease in order to treat existing diseases and prevent outbreaks in future. So really, for me, I think this probably, if you reporting epidemics and pandemics, they need to be, actually, you need to be very close to them. And my other thing I realize is that you also need to establish reliable and informative sources of stories, sources that will make your stories stand out, sources that will help you navigate through the plethora of data some of which can be actually conflicting. I realized actually from the beginning I needed to have actually regular conversation with scientists, with policymakers, these individuals in the Ministry of the Health in my country, individuals in the Kenya Medical Research Institute. I think most countries have these kind of research institutes. And also I realized I have to have conversations with economists, because in time this disease stopped becoming, the health angle, we moved to economic angle, we found the disease affecting the economy. So we needed to speak with health economists to bring new angle to our stories. And also last year was also what I noted last year. In the beginning, a lot of studies came up. A lot of studies were beginning to be done. So this is also something I realized you need to watch out. A lot of studies were done last year, how the disease affects people with other comorbidities, like people with diabetes, how the disease affects people living with the HIV. And what I've realized, a lot of those studies are coming out now. So you really need to watch out for that, and also for the timeliness of these studies. If I may give an example, at the beginning of this year, I saw a study that had been done in February. It came out in around April or May. It was on the vaccine acceptance in Kenya, which in February, actually, it was extremely low. It was less than 50%. But when this study came out, it came out in May. But if we reported on this study at this time, we needed to be very careful, because when the study was done, the president of Kenya had not been vaccinated publicly. The Minister of Health had not been vaccinated publicly. The first vaccines had not come to Kenya. So there was very little, there was a lot of vaccine hesitancy in Kenya, acceptance in Kenya in February. But by May, when this study came out, it had actually jumped up because we had seen the president being vaccinated publicly. So when you look at the studies that are coming out now, actually you need to see when this study was done, what might have changed since then. Really, we need to have this in context. The other thing I saw last year that we dealt a lot with is on the modeling. There was, in the beginning, especially in April, a lot of models predicted different outcome, or different how the pandemic would turn out. And there was a lot of reporting on this, also a lot of misreporting on this. I think we always, one thing I realize is always we need to understand how scientists come up with the models. They're all based on assumptions. So we need to understand on what assumptions. You need to ask the scientists who have come up with these models on what assumptions they are relying on. So this is something also to watch out, and also to be careful about. If we may go to the next slide. So in getting my stories, in writing my stories, I have a couple of websites that I've found to be very useful. And one of them has been the World Health Organization website, especially this update on weekly epidemiological update, where we have, if there is any variant that has been detected, it will probably come up here. And also on the main WHO website, there's a lot of information there on the different studies, on the treatment, the vaccines, the vaccine candidates. So this is something for you to, this is a great resource for journalists. The next slide. For me, this also has been a very useful website, covidtrials.org. Basically, it lists all the trials on COVID-19 that are going on in different countries. For instance, if I go to Kenya, then I can see the different trials. And then when you click on this, you can see which probably vaccine candidate is being tested. You can see what treatment is being, or therapies that are being tested. So this is a great resource for journalists. I think you can check in your country, you can see, because the institutions in our country, for instance, in Kenya, all these trials are supposed to be listed by the Pharmacy and Poisons Board, which approves all these trials, but it doesn't make this information public. But here you can actually get information on trials in your own country. The next slide. This is Google Trend. It's also found this website very useful. Probably if you go on Google Trends right now and you type COVID-19, most likely you'll get a lot of search on Omicron, this new variant. And so it's a great opportunity to know what questions are people asking. In the past, when I checked, it was about there's a lot of many countries like UK putting African countries on the red list, blocking travel from African countries. So you get a lot of information on what people are interested in, what are they searching for, and in my articles I've tried to answer some of those questions. Let's go to the next slide. So in the end, like for now, it's been 1 year and approximately 5 months, and I think the public has got most of information about COVID-19 from the media, and therefore, just before this variant Omicron came about, I think before it was reported on November 24th by South Africa, actually there was a tendency, especially in my country, for people to think it's over. And actually we saw a lot of stories being pushed to the back pages or inside maybe in the bulletins. Sometimes we didn't have stories on COVID-19. So it's really easy for people to think that the COVID-19 is over. But I've realized, well, it's important not to overwhelm people, but we need to tell people that actually it's still a threat. We still have new variants. If people don't get vaccinated, these variants will still come up. So one of the things we can do to keep this story on COVID-19 running, actually we need to track the development of new drugs. There are so many therapies that are being tested in different parts of the world. We also need to, we still have the vaccines that are there available in Africa. I think about 9 of them. But we also have other candidates that are being tested. So we can also write about them. We also need to check. I realize also we must not neglect stories that we think are not interesting. One of the things I realize is that actually not every story you write on COVID-19 will be hard-hitting. Some story you might have to write about hand washing. Actually it has been a great way to prevent the spread of this disease. The other thing is that also you must not be afraid to write on non-familiar topics, because you realize actually a disease outbreak is not just a scientific issue. You'll find yourself, if you're a health journalist, and I assume many journalists here, probably health journalists, you'll be writing on economics, how the disease is affecting the economy. You probably need to learn a few things about the economy. You also need to continue the scrutiny of authority. When we had the last year in Kenya, we had something we call a scandal that was called a journalist unearthed the scandal in the Kenya Medical Supplies Authority on the agency or the authority was supplying overpriced PPEs and drugs, and a lot of money was lost. So we still need to keep scrutiny of the authority. For instance, when we had our first vaccines, the government announced that a dose cost only $7, but when we saw from UNICEF, Kenya was getting the doses at $3 per dose. So we really need to keep the scrutiny of the authority, and also we also need to look for non-obvious angles. Actually, big stories often end up with a number of common narratives that need to be followed up and reported on. And in pandemics, these include, I think in Kenya, I see the Ministry of Health still continues a running toll of diagnoses, recoveries, and deaths every day. We still need to keep on reporting on these, the healthcare issues. Last year, we reported a lot about the availability of oxygen in hospitals. We still need to keep an eye on these. The quarantine, how effective is it right now? How effective was it last year? The political response, the economic responses. So we still need to keep an eye on these things. And the next slide, which I think should be my last slide. So last year, this is interesting, and this is why I put this slide here, because last year we had a number of health journalists from Kenya who were admitted with mental problems during the pandemic, and mostly it was because like we slept, we ate, everything about our life last year was a pandemic, but we do not want to become part of the story. Journalists, we must realize also our mental health is very important. It's very important for you to get a chance to switch off the story. You don't need to spend all your time 24/7 scrolling on the Twitter or in the newswire to catch the latest on COVID-19. Probably sometime when you finish your shift, you also need to create as much as of a normal routine as possible. If you normally go to play football after your work, you probably need to go and do that. If you normally watch your favorite TV shows, you need to go and do that. Yeah, this is really important also for us. I want to share two stories I did last year. I did many stories. I just chose two. I'll share on the chat, which maybe you can look at during the discussion. They're basically the first one is basically a story on it's an economic story, as much as the pandemic is a health issue, but the biggest effect in Kenya last year was economic. Actually, we saw during the lockdown a lot of businesses went down, especially affecting women, small businesses, and this was a big issue, and everybody was asking, when is this going to be over? But actually we had to say that until we have the vaccines, probably the disease will keep on spreading, and it's probably not going to be over soon. So this was a great message to pass, because there was this idea that Africans are not being affected by the disease. And while this was the case, we didn't see a lot of cases in Africa compared to the rest of the world, but economically it was very devastating. So this was important for us to mention. And also the next story, it was on the vaccination. There was a study that showed the vaccination, which was very slow in July this year. It was going to slow the country's economic recovery until 2024. So as much as this disease, it's not so many, we didn't see toll as, the toll was not as high as we saw in Europe, but the economic toll was actually devastating for Africa. So this is, we have to keep on telling people, this is why it's important. Vaccination is actually important, because if a good number of if majority of people are vaccinated, then we can be able to open the economy fully. Yeah, I think for now, that's all I have, and I'll be happy to answer some questions at the end. Thank you very much, Wayne.
Thank you, John. Yeah, I noticed on your second last slide there, you talked about reporting on stories that are not interesting, and it just made me think of, you know, a lot of the data that we get about COVID-19 is statistics driven. The economic reports are very much to do with data and numbers. I'd just be curious to hear how you take that kind of information and how do you make it accessible to your readers? Do you have any tips on how you can take what can be very dry material and turn it into something that will catch the eye of the average person reading the Star?
Yes, because all these statistics are actually people. These statistics are human beings. So important is always to bring the human aspect on these statistics. When we actually, of late, we don't have many people dying, according to the report we are getting from the Ministry of Health. On a daily basis, we probably have 1 person or 3 people, and it's easy to dismiss these as just numbers. But actually, these are human beings. This could be somebody's dad or mother. So what we've always tried to do in our trainings with journalists or in our science cafes is to ask journalists to, as much as possible, put a human face to these statistics, speak to people, and then you can bring in the numbers. And everybody will identify with human beings, with the stories of people. Yeah, thank you.
Thanks so much. And your comments about journalists essentially taking the self-care that journalists should keep in mind when they're reporting this story. You know, journalists covering COVID-19, it's like a tragedy that just won't end. It keeps going on and on, going on to 2 years now. And I take your point that for journalists, you have to keep in mind you're covering this story. It's a big part of your job, but you have to be able to leave it at the office and go home and think of more positive things. So I really appreciate your observation there.
Most welcome.
Thanks. And if our viewers have any questions for John, continue to put them in the chat box if you like, and we'll get to them. And but for now, I think we will switch over to our second keynote speaker. This is Dr. Ope Ogundiran. Ope is an epidemiologist working with the Emergency Preparedness and Response Program at the WHO Regional Office for Africa in Brazzaville. In the past 2 years, the majority of his work has been to strengthen epidemiology and surveillance for COVID-19 and other infectious diseases in the 47 member states of the WHO Africa region. And Dr. Ogundiran is going to focus on, of course, what's on everyone's mind is this new variant, Omicron. So Dr. Ogundiran, welcome, and please, the microphone is yours.
Thank you very much, Wayne, and good afternoon, good morning, good evening, colleagues. It's a privilege being amongst colleagues from this aspect of the world. I'm usually more surrounded with scientists and epidemiologists like myself, so it's a good breath of fresh air to leave that room, and don't tell them I said that. I guess the importance of your work has come to light, as many other things have during this pandemic, but more specifically about this new field of infodemiology, so management of infodemics, and I guess the the validation of the amount of work that people in the field do is we recently had some end of year awards for persons and teams in WHO globally. And for the African region, the team that got the best award was the external communications team. Pretty much exactly what you guys are doing. So we completely appreciate what you're doing. And today I would not talk too much about the overall pandemic in the region. I think we've heard quite a lot about that, but I'll try to focus on what today's conversation, today's interest would be. And this would be about the Omicron variant. So Christoph, if we could move to the next slide. I'll touch on this, the global situation, just so that we know where we are number-wise. So as of today, early this morning, when we collected this data, there have been 270 million confirmed cases with about 5.3 million deaths globally. The African region, which are the 47 countries, excluding 7 countries. So these are Tunisia, Sudan, Morocco, Somalia, Sudan, and Djibouti in the region. And we use these terms operationally in WHO. But those cases, in the African region, the number of cases that have been attributed to the region are 2.4% and about 2.9% of the global deaths. If we look to the left side, to the right side of our slide, we see the trends. The important thing to note before I move on to the next is we're continuing to see a pandemic that's evolving really quickly. The number of cases are still pretty high. We're reporting an excess of 500,000 cases every single day. But if we look to the bottom right, we see these blue lines, which is the African region. And what is important to notice is that spike in the number of cases being reported out of the African region. On the next slide, I'll expand that a bit. I can see Wayne straining a bit to see that. So making it a little bit bigger here, what we've seen, and these perpendicular bars account for the number of cases being reported daily. As we can see in the African region, the left side of the slide at the bottom, we see these really high number of bars being reported in the last 3 weeks. In the last week alone, we shot back to close to the peak of the Delta wave. So we've seen a really high spike in number of cases. And if we see, the colors are depictive of the sub-regions. The light green bars show the number of cases being reported out of the Southern African sub-region. And as you can see, that's where most of the cases are being reported from. Shifting our focus to the bottom right of this slide, those are the countries in the Southern African sub-region. And we see countries like Eswatini, like South Africa, Zimbabwe reporting exponential increases, almost perpendicular increases in number of cases being reported. But if we look at the top 10 countries, so that's the table just above those charts, we can see South Africa, Zimbabwe, Reunion, Namibia, Eswatini reporting the highest number of cases in the last 24 hours. Next slide, Christoph. So that was a little bit of a background to show where we are as of today. What we found is almost exactly when we started seeing this increase in number of cases, a new variant, Omicron, which we know as of today as Omicron, was detected. And daily with data coming through, we're seeing this variant more and more implicated in this upsurge. But let's just go back in time to when we first identified it. So on the 26th of November, the WHO designated the variant, which was known as the B11529, as a variant of concern. And this was done by a specialized group, which we call the TAGB, the Technical Advisory Group on Virus Evolution. The reason why they made this decision was because the variant had several mutations. Mutations in, not to sound too technical, means the genetic component has changed, essentially. But what was particularly concerning about Omicron was viruses would usually mutate to survive. It's one of their survival mechanisms. But what we saw with Omicron was the number of mutations was unprecedented. It contained all the different mutations that the previous variants of concern had, but even more. So that was why it was particularly concerning. And at the time, there was quite a lot of worry about its level of transmissibility and severity of illness. So like John said earlier on, Omicron was first reported by South Africa on the 24th of November in a specimen collected on the 9th of November. Coincidentally, Botswana also collected samples on the same day. So just to highlight that the impressive science that came out of South Africa was also reported from Botswana. And I don't think we give Botswana enough credit when it comes to this. But what we've seen is Omicron has, like I said, an unprecedented number of mutations on its spike protein. And what we've seen so far, or rather at the time, the preliminary evidence suggested that there was a high risk of infection. And I'll touch on that down the line. Next slide, Crystal. So as of when this data was collected yesterday in the evening, the 14th of December around 4 p.m., we had a total of 70 countries worldwide that had reported at least one confirmed case of Omicron. We've seen Omicron being reported from all the WHO regions. There are 6 of them globally. And yes, our continent, our region is also one of those affected. On the continent of Africa, as of when this data was collected, there were 12 countries, and those are the ones in the red text that had confirmed cases. But we also had a few countries that we've been monitoring over the past few days that have not reported indigenous cases of Omicron, but international travel has implicated them as points of origin where cases tested positive for Omicron. So we're supporting these governments to be able to carry out larger investigations to establish the presence. But this number, as you would expect, would continue to change very rapidly every day. Between when this data was collected and now as we speak, Algeria has reported their first case of indigenous Omicron, and also Somalia and so that's Uganda. I can't remember what country the second one is, but 2 countries have also been implicated in international travel. So just to highlight that as we go, the number of cases, number of countries, this map will continue to evolve. And I'll talk about transmissibility down the line. Next slide, Crystal. Crystal, thank you. So I'm sure we're itching to know, what do we know about Omicron as of today? So apart from its spread, what do we know about the different parameters that we usually assess a variant by? So the first one is transmissibility. How easy can this virus move from one person to the other? And we use that as a measure to understand, one, the epidemiology of the virus, but also to understand its impact. So regarding transmissibility, as of now, the data we have, and generally I would say this as a blanket, we are still in the early days of comfortable data, if I may use that word loosely. Information is still coming in quite quickly, but maybe not as much as we'll be able to make generalized statements about it. So just so that you know that the information we have as of today is what we have now, but this information is evolving every day. So regarding transmissibility, there is some current evidence that suggests that Omicron has increased transmissibility when we compared it to Delta and the other variants of concern. We've seen in Africa, we have gone through 3 waves. The most recent was the Delta wave in the middle of the year. But now we've commenced the 4th wave after seeing 2 weeks of more than 20% increase consecutively. So the 4th wave in Africa has commenced. But what we've seen, and a little bit tying to the point of transmissibility, is this is the fastest evolving wave that we've seen so far. We usually calculate this in 2 parameters, the growth rate and the doubling time. And on these 2 parameters so far, apologies for being too technical, we've seen comparatively that this is the fastest growing wave since the beginning of the pandemic. So the number of people tested positive has risen in many countries all around the world, like we've seen. but epidemiological studies are underway to understand the true impact of Omicron and in addition to other factors. So a little bit of concern, or a little bit of caution rather. At this time, at the end of the year, for the past 2 years, we had seen an upward trend in the number of cases, regardless of if it was a new variant or it was the wild type. Where at the same point today, we're seeing an increase. So it's easy for us to attribute a lot of these to the existence of Omicron, but regardless of the fact that we had Omicron 2 years ago, we also saw this. So a lot of studies are still ongoing to see the effects of Omicron, or is this a multiplier effect, the variant coming above other factors that could then cause this exponential increase. The next parameter we usually ask for is the severity of disease. As of now, it's really not clear whether Omicron causes more severe disease compared to others. I will touch on 2 studies that are being conducted in South Africa, which are answering some of these questions, but we just don't have enough data yet to give a general position on the severity of disease for Omicron. There's currently no information to suggest that the symptoms associated with Omicron are any different. And I think this was touched on right in the beginning of the conversation. But nonetheless, we should keep in mind that all variants of COVID-19 can cause severe disease and death, in particular for people who are particularly vulnerable, so the elderly, immunocompromised, and the likes. And as such, prevention is key. We are not yet at a stage where we're comfortable enough to not have these clear-cut preventive measures. Next slide, Christoph. The next parameter that we usually worry about with variants and new viruses, as a matter of fact, is the effectiveness on vaccines. So as of now, WHO is working with technical partners to understand the potential impact of this variant on existing countermeasures, including variants. But we should note that vaccines remain critical to reducing severe disease and death, including against the dominant circulating variant, Delta. The reason why we use dominant here is globally, even though we've seen Omicron rising, Delta still remains the dominant variant. We are seeing this change, especially in countries like South Africa, and I'll show one slide on that. But yeah, what's clear is, regardless of the fact that, and I think I would respond to that as a question, but just keep in mind that vaccines continue to remain critical. Current vaccines remain effective against severe disease and death. The next parameter we usually want to have some inquiry on is the effectiveness on current treatments. So there are 2 major treatments that we've used over the past few months, corticosteroids and IL-6 receptor blockers. And these have still remained effective for managing patients with severe disease. But the other treatments are still being assessed, and as of now, we don't know the immediate effect of the variant on the performance of these treatments. Christoph, next slide, please. So regarding tests, another thing we try to know is, are we seeing any escape from diagnostics? Currently, the diagnostic tests continue to detect the variant, so which is some good news. But in addition to that, the way the variant mutated, it did something what we call the S gene dropout. So on the S gene, there's one PCR test that constantly missed this marker while testing. And that was the reason why we could detect Omicron quite early. It was somewhat of a malfunction that worked out as a screening test, which was quickly picked by scientists in South Africa. And because of that, this was in the PCR, polymerase chain reaction test. These samples are then sent for sequencing, which is usually a more detailed genetic test to be able to see what is happening at genome level. And that was how we detected the variant quite early. So there are studies that are ongoing to see if we can use this as some form of early warning test to see if we can detect Omicron with it. But just to really highlight that studies are ongoing to determine whether there's any impact on the rapid diagnostic tests, which are being used quite commonly. The last area we usually want to know is with reinfection, and the evidence we've seen suggests that Omicron has a higher risk of reinfection. So people who have had who have had COVID in the past to have a higher likelihood compared to the other variants of concern for Omicron. Next slide, please. Christoph. Thank you. So here, this is a study that just got completed in South Africa. This is courtesy our colleagues there in the Network of Genomic Surveillance in South Africa and Discovery Health Analysis. The reason why I'm touching on this just quickly to see is if we look to the left side of our slide, this is to show that Omicron is now dominating in South Africa. When we look at the variants, so it's displaced Delta. It's not all bad news because if we have a variant that is so far and now moving to the right side of the slide, what we've seen in the past with the wild type, the one that was discovered in China, and all the other variants of concern is when we had cases increasing, we also had the number of admissions increasing and also had the number of deaths increasing. For the first time, this is not the case with Omicron. We are seeing a marked increase in the number of cases, but we're not seeing as high an increase in the number of admissions. But more importantly, the number of deaths are actually even still on the decline now. So this is some preliminary information which we're looking at really closely. And if, and I'm using if in capital letters underlined with bold, if we do have this variant that is less severe, causing less admissions, causing less deaths, and it's displacing the more severe Delta variant, maybe there will be some hope to see a less severe pandemic. But once again, let's remember the if. But so far, this is the information we have regarding the number of cases, admissions, and deaths. It's still early days. As you can see, Omicron was discovered at the end of November, and we're pretty much about a month. So it's still early days to call it, but so far, this is what we're seeing. Next slide, please. So over the next few slides, I think there are 3 or 4 of them so that I can shorten the time. I would just talk briefly about vaccines generally. What we've seen is we've seen a significant increase in the number of vaccines that have been delivered to Africa, but more importantly, that have been delivered to arms of individuals. In total, there have been more than about 455 million doses delivered. About 58% of them have been administered already. So there have been some concerns with why we do not have a higher percentage, but just to highlight that in recent days, we've seen quite an increase. Next slide. I'll just quickly ramble through this slide. This slide is showing us that we still have quite a number of countries not administering as quickly as we would like them to. And I guess this would be a little bit of focus for countries to increase the number of vaccines. Next slide. The next slide. So next slide shows, this slide shows what that picture looks like in the last 8 weeks. There's another slide down the line that makes it a little bit clearer, but just to highlight that even though the number of countries that have administered vaccines are not where we are, there's been a ramp up in the number. And in the last 8 weeks, we've seen a better picture. Next slide. Regarding the coverage, many countries are still reporting less than 10 cases per 100 population. We have quite good coverage in a couple of countries like Seychelles, Mauritius, and Morocco, but majority of the countries in the region are still reporting less than 10 persons vaccinated per 100 population. Next slide. And in the next slide, we see this a little bit clearer. So the green trend shows the number of doses received, and the brownish one shows the number of doses administered. And as we can see from mid-August, we've seen this significant increase in number of doses that have been received and those that have been administered compared to before August. Next slide. So I put this slide up because I think this is the type of information that you particularly would need as journalists. These are recommendations from the TAG VE, and they are in two aspects. One for countries, what type of recommended action should countries be carrying out? And the second half are for individuals, for you and I. So for countries, we need to improve surveillance and sequencing efforts so we can quickly detect variants of SARS-CoV-2. Whenever we have our findings of those actions, they should then be uploaded to public databases, and the one that we're using presently is called ESAR. And whenever there are findings of investigations, these should then be reported quickly, promptly to WHO through the IHR mechanism. In coordination with the international community, countries are to perform field investigation and laboratory assessments to improve the understanding of the potential impacts of the variants of concern on these different parameters that we spoke about earlier on, the severity, how it handles the drugs, vaccines, transmissibility, and the likes. Next slide. But more importantly, and this is strongly associated to this closure of borders to countries, countries should continue to implement effective public health measures to reduce COVID-19 circulation overall, using a risk analysis and science-based approach. There's been a lot of debate about closing of borders to the Southern African countries, when many of the European countries surrounding the countries that close their borders even have way more cases. Now, that's not science-based, so countries are advised to make sure response is risk analyzed, so weighing into economies, weighing into what the impacts are beyond health impacts, but also science-based. If we're seeing a number of cases increasing in a country and their borders to those countries are open, but other countries that have less are being closed, then we might need to review that. Countries are also to increase some public health and medical capacities to manage an increase in cases, but more importantly, at the country level, the inequalities that exist between access to vaccines, access to healthcare, access to social structures should be addressed. So those were the next slide, Christoph, those are the points for the countries. For individuals, throughout the pandemic, Christoph, next slide, please. Throughout the pandemic, we've seen very evidence-based measures that we are almost forgetting about with the advent of vaccines that have been helpful. So individuals are reminded to take measures to reduce the risk of COVID-19, including proven public health and social measures, which are wearing well-fitting face masks, hand hygiene, physical distancing, ventilation in indoor spaces, avoiding being crowded, and more importantly, getting vaccinated when you get the opportunity to. And I think we can't sound this more. There's never a better time for us to do that than now. We're going to see people traveling for the end of year festivities, mingling, which is going to happen. So we should not forget this part. I think Omicron helped us jolt back to life, but nonetheless, these measures that we've used since the beginning of the pandemic, I think we should keep on sounding it because they've worked. In areas where people have used these, even when they're not vaccinated, these measures have worked. But the more important thing for every one of us is the way we can contribute as individuals is to reduce our risk of exposure. And that's a personal decision. So you have gatherings at the end of the year. We should always have that question at the back of our mind. Is this necessary? Do I need to be in that place, in a crowded area without a mask? Is it possible for me to social distance in these areas? And then we make those decisions with the basis of reducing risk of exposure to the virus. Next slide, please, Christoph. So I will quickly try to wrap this up in 30 seconds, I hope.
Dr. Ope, there's a question. I'd like you, when you wrap up, you answer that question. It's coming from Kitabu Nango from Juba. He's asking about vaccine effectiveness. He's asking if folks are fully vaccinated, and how is it that they're still getting COVID-19? That is from Kitab Unango from Juba, Southern Sudan.
Thank you.
You can wrap that up and also answer that. Thank you.
Thank you very much. Thank you. I would answer that immediately. I rumble through this. So what we've seen so far is we've seen an increased number of cases of COVID-19 on the continent. It's coinciding with the discovery of Omicron, and what we found is that the variant has spread to over 70 countries. Preliminary information from South Africa shows that Omicron is displacing Delta, but like I explained earlier on, it might not be completely all bad news. It's still early to say, but just keep that in mind. Though we're seeing a rapid increase in number of cases, the number of admissions and deaths are not occurring at the same rate. We are seeing an increase in uptake in number of vaccines in the continent, but we're still not where we want to be. We hope to be able to get more vaccines and get better access. And countries are advised to employ risk-based and scientific approaches when implementing restriction measures. And for us individuals, we should keep in mind that we should always reduce the risk of exposure. Now, to quickly answer that question, and I think this is a story we've not told well enough. The first thing is the vaccines do not prevent us from being infected. At no point in time has anybody, even the vaccine manufacturers, come out to say, the moment you're fully vaccinated, you will not get COVID. The vaccines are not designed that way. There are some diseases that will, I'm not even sure there are actually a lot of diseases that when you're vaccinated, you can't catch them. What would happen is the clinical sequelae, let's call it the way the virus would then affect you, would then be modulated. Now, what the vaccine does is to reduce the chances of developing severe disease. So if we think about it as, and the way I easily describe it is when the Delta variant hit, especially India, a lot of people were not vaccinated at the time. And we could see the number of people that ended up in casualties. It was this horrifying pictures we saw out of India. But then again, people then started getting vaccinated. And in many cases, people then got infected, but because they were vaccinated, they had mild disease. They were at home. They tested positive, maybe when they wanted to travel, but they didn't need oxygen support. They did not need intensive care. So I think we should clarify that right from the beginning, that the vaccines will not prevent you from getting Omicron. What it prevents you from is getting severe disease or probably dying from it. So I hope that clarifies that.
Yes, thank you very much. A couple of questions, please.
Of questions, yes. I'll be happy to take them.
So Anne Mikia from Nairobi, Kenya is asking, is it true that more young people have been affected by the new variant? And the second question from Elizabeth, how can we be sure the vaccine is effective in COVID since the cases of the vaccinated are many? I think you've touched on that.
Yeah, I'm not sure I got the second question.
So how can we be sure the vaccine is very effective in countering COVID since very many vaccinated people are still getting reinfection?
Are still getting it. Okay, yeah. So I think that has been responded. Yeah, people would still get, I mean, if you're exposed, if you're not wearing a mask, you're not social distancing, you would still get COVID. The good news is if you're vaccinated, it's very unlikely you would end up needing oxygen or being in an intensive care. Okay, so let's sell that story a little bit more. This is not to say the vaccines do not work. They do work. And what we don't want, I mean, if we're being factual, a lot of us have the sniffles. We are sick with some virus, but does the sniffles get us into ICU? No, it doesn't. So that in itself is a big benefit, okay? The question about younger people. Now, what we've seen, preliminary information coming out of South Africa, is that we are seeing a higher number of younger people, less than 5, are testing positive. Like I said, it's still early days. It really is still early days. These are people that have been in close contact with people that have tested positive. So we're looking amongst people who are contacts. So for example, somebody tests positive today, we look at the number of people that have epidemiological links in time, place, and person close enough, and then test. And what we've seen is more younger people are testing positive compared to the previous variant. But this is still very early. It's only South Africa. We can't make a judgment call for what's happening, say, for example, in the other regions. There might be other factors, like I said earlier on, that might be attributed to this. So it's still early days. But so far, the preliminary information we are getting as of today shows that we have an increased number of younger people getting infected. Now, I should also add, are these younger people falling ill to the extent where they are getting severe illness and they're dying? No, we're not seeing that. The only thing we're seeing is we're seeing a higher infection rate in these group of people.
Thank you, Doctor. Back to you, Wayne.
Thanks, Tole. Thanks very much, Ope. I'd like to thank both John Muchangi and Dr. Ope Ugandaran for joining us today. Fascinating discussion. I just want to tell everyone here that we have recorded this dialogue. So for journalists on the call who want to revisit these talks in order to get your quotes for your stories, we'll send you a link right away to this this event so that you can go back through it at your leisure. Also, I'll let you know, for people who are on WhatsApp, we're going to be sending excerpts of this media dialogue out to everyone who shared their WhatsApp details with us. And we welcome more questions for experts through that platform. We will make sure they get those questions if you think of something after you want to ask. We look forward to seeing you all again in the new year. We're planning to have more media dialogues hosted by the East and Southern Africa Region RCCE Media Working Group. And with that, yes.
Wayne, excuse me,
ahead,
if I can. Sorry, I just want to let folks know that I have shared a few links on the chat. There are links to the Health Journalism Network. Internews has a Health Journalism Network that is a network of health journalists around the world, and it offers a lot of opportunities, a lot of grants, a lot of interactions. Please enroll on that network. You'll meet with your peers, and there are lots of opportunities there. And I've also shared the 2 free online courses, which were done by Internews. Let's Talk Vaccine and Let's Talk COVID-19. In fact, WHO has sponsored Internews to translate the course into Arabic, and Sabin Institute has sponsored the course to be translated into French. So these are free courses which will be useful for journalists to take as we move forward. Thank you very much.
Great. Thank you very much, Tole. Okay, thanks to everyone who attended. Thanks to our speakers. And until next time, I'm Wayne Sharp saying thank you and be safe. Bye for now.
Thank you, everybody, and have a good evening.
Bye.
You. Have
Thank you.
a good day. Thank you.
Thanks, everyone.
Bye.
Thank you. Goodbye.
Thank you, everyone. Have a good day.
Bye.
Thank you. Bye. Happy holidays.